Vietnam is a beautiful country located in Southeast Asia. Our research brings us to the lively city of Hanoi, the capital of the Socialist Republic of Vietnam, where we began looking at mental health. Common mental health disorders, such as depression, anxiety, and PTSD, can significantly decrease quality of life. Depression alone affects over 300 million people worldwide, and both depression and anxiety are in the top 10 leading contributors to the global burden of disease. Common mental health disorders remain underaddressed and underdiagnosed within low to middle income countries like Vietnam. This is especially true of stigmatized or marginalized communities, such as the methadone maintenance therapy population. Methadone is an opioid medication that is prescribed to substance use patients who developed an addiction to the street drug commonly known as heroin or other opioid drugs, sometimes given by prescription for pain. Methadone is meant to reduce cravings and prevent opioid abuse. Studies have previously shown that depression and anxiety rates are up to 10 times higher among the methadone population compared to the general population, and still 2 to 3 times higher than in substance users not on methadone. Methadone compliance is also affected by comorbid mental health disorders. Because of this, we need a permanent screening tool or structured diagnostic interview for methadone patients to address and treat common mental health disorders. While a wide range of screening tools exist to detect common mental health disorders, many have not been locally validated because they were designed, developed, and tested in high-income countries. It is important that screening tools are locally validated to promote accurate detection and diagnosis of mental health disorders. Our study investigated how we can better detect common mental health disorders in methadone maintenance patients at a clinic in urban Hanoi. We trained 2 Vietnamese research staff to interview the patients. One interviewer administered 3 screening tools to look for depression, anxiety, and PTSD. The other interviewer administered a gold standard instrument known as the Mini International Neuropsychiatric Interview, as well as a demographic questionnaire. We enrolled and interviewed a total of 400 methadone maintenance therapy patients. Our preliminary results show the prevalence of depression was 10.5%, anxiety was 4%, and PTSD was 2%. Of all participants, approximately 22% of patients were HIV positive. While we were able to test the validity of screening tools within the methadone maintenance population, we still need to make first-line treatment medications, such as selective serotonin reuptake inhibitors, available for use in Vietnam. Common mental health disorders need to be screened for and treated just like any other medical disorder, especially in high-risk populations such as people living with HIV and methadone maintenance patients. With further research and support to study mental health, we can bring awareness to disorders such as depression, anxiety, and PTSD, as well as treatment to reduce their respective burden of disease.